Well, hi guys, this is Dr. Bailey from TrayMinder. I'm a practicing orthodontist and the co-founder of TrayMinder, an app for clear aligner users. Today I'm going to show you how to hook and unhook your rubber bands. I know it seems pretty simple, but there are actually quite a few little nuances and tips that you can use that will hopefully help you to make the process a little bit easier. Now, if you're interested in knowing why rubber bands are used, I have created a video called Rubber Bands 101. I'll link the video below, and it's a comprehensive guide on why elastics are used, what they're used for, the different varieties of rubber bands, and such. So if you're interested, definitely check that out. So without further ado, let's talk about how to hook up your rubber bands, okay? So before we get started, there are different ways, there are different components that you use for hooking up rubber bands. The most common is called the precision cut. A precision cut is basically a cut or a slit that is made within the clear aligner itself. So in this example here, the canine has a cut here. This cut is used to hook up your rubber band, and it's used in lieu of buttons. All right, there are buttons or there are tubes that are used, and that's another alternative too. So let me show you what a button would look like. Sometimes orthodontists will use buttons like this right here instead of precision cuts. All right, so that's another way to hook up your rubber bands. All right, so let's go over the most common way to wear your elastics, which is called a class 2 elastics. Class 2 elastics just refers to the direction in which the rubber bands are hooked up. In class 2, you would put you're hooking up the bottom molar to the upper canine usually. So right here. Okay, so when you are putting on rubber bands, and I'm going to use a purple rubber band here so that you can see better. This is not an actual elastic that is used, but it helps you to see better. So when you're hooking up a class 2 elastics, it's always easier to start on the tooth that is further back or harder to see. All right, so in this case, the bottom molar. So what you'll do is you'll reach inside and hook up the molar. Okay, a lot of times patients have their mouths open. You actually don't want to do that. Go ahead and close your mouth. When you close your mouth, you're stretching out the rubber band a little bit less, so it's easier to place. So once you have put your rubber band on the molar, give it a little bit of a tug, a gentle tug, and then hook it up right here. All right, and so that's how you do it. To take it off, you're going to do the opposite. You'll release the precision cut on the canine first. Okay, and then once you unhook it, you can take it out, or you can open your mouth and take it out. The reason why I like to start from the easier tooth is that you have better access, and once you unhook that, your rubber band is no longer under tension, and it makes it easier for you to take out your elastics. All right, so in summary, to put it on, start on the lower molars first, and then hook it up to the canine. When you're remove from the canine first, and then put it and then take it off on the molar. Now there's one alternate way of attaching your rubber bands. Now if you're having a hard time hooking up both sides of the molars, you can do what's called preloading. So preloading is when you hook the rubber band up first, so like this, okay, and then you can do it to the other side as well, and then go ahead and seat it in your mouth with the rubber bands hooked on. So in this case here, I only have a precision cut on the upper, so that's what I'm going to do. So have it like this, seat it, okay. So imagine there's another rubber band on the other side. Now close your mouth and then stretch and hook it around the bottom. Okay, so this is called preloading. You're preloading your rubber bands onto the tray. You seat the tray, and then you hook up the opposite arch. All right, so that's a good little tip that not a lot of patients know about. Now let's go to class 3. Class 3 is just the opposite of class 2. In class 3 patients, you'll hook up the upper molar to the lower canine. So, and that's class 3s are used for people with underbite or edge-to-edge bite, where the lower teeth are too far forward in comparison to the upper teeth. So again, with class 3s, I would start on the upper this time because it's harder to reach in the back. So hook up the upper molar, close your mouth, stretch the rubber band onto the lower canines and hook it up. To remove, you're going to do the opposite. Release the lower molar or the lower canines first, and then you can release it from the upper molars. And again, you can preload as well too. So my patients will preload the back molars, and then hook up the lower canines. Now I have to mention that preloading is only used for precision cuts. So those, again, precision cuts are the slits in your aligners. If you have buttons on your teeth, then you don't have to preload. You just go ahead and pop in your aligners and then hook up your rubber band. So I just want to make that point really clear, because with buttons, there's no need to preload. It's easy. For some of you, it's difficult to use your hands to reach all the way back to the back of your mouth to hook up the rubber bands. Either because your fingers are a little bit bigger or thicker, or you may have some arthritis or some decreased function in manual dexterity. That can be common. And so in cases like that, I would recommend a hook tool like this. You can get that from your ortho office, or you can purchase that. I'll place a link below. But what you do is you hook up your rubber band like so. And with the rubber band on, it's easier to reach back here. Okay, there we go. All right. And now close your mouth and then hook it up in the front. And again, it's not super easy. And I get it. There we go. So you hook it up and then you let go. So just like anything, rubber bands, aligners, it's hard at first when it's new. With practice, you'll get better and it'll get easier. At some point, you can probably just hook it up without even using a mirror. So just don't give up. So the next thing I want to talk about is changing your elastics. Because elastics are made out of latex for the most part, they get stretched out, and once they're stretched out, they don't work as well. So I would recommend to my patients to switch out their elastics at least 3 to 4 times a day. It makes it more sanitary and they work more efficiently. The next thing I want to talk about is troubleshooting. For patients with precision cuts, sometimes the slits are really well adapted to the teeth, and it's really difficult to hook the rubber band around it. So in cases like that, I would advise that you pull this part out a little bit away from the teeth so that it's easier for you to hook up your rubber band. So go ahead and pull it out a little bit. This usually is only an issue when you're starting a new aligner, when the slit hasn't been used very much. You'll find that as you go on, it'll be easier to hook them up. All right. And then the second tip is that you hook up your rubber bands and then they slip off of your precision cut. So, and I had alluded to this a little bit earlier. Once you hook up the rubber band, let's see once you hook up your rubber band like so, give it a gentle tug. This helps to seat the rubber band a little bit further down so that it's less likely to slip out. All right. Now on occasion, sometimes your buttons that you use to hook your rubber bands on comes loose. It may just happen, or you ate something a little bit hard. If that were to happen, definitely give your orthodontic office a call and let them know, and they can appoint you back to get that rebonded. If you're away, you can't come in, you're on vacation, you can always call and ask if it's okay if you make your own precision cut. So basically what you do is you create that slit either on that same tooth or that molar, let's say on the class 2, you can use the premolar, the tooth that's in front of that or in back of that, and make a slit in the tray itself. You can use a pair of scissors and you create your own precision cut in which to hook up your rubber band. That's a little bit complicated. I don't usually advise patients to do that. It's always best to just get the button rebonded, but in a pinch, that could be a smart, creative solution to allowing you to continue to wear your rubber bands. All right, well, I hope that this video has been helpful for you. If you like it, please give it a thumbs up. Please subscribe to the TrayMinder video so that you can continue to receive more helpful tips. If you have any suggestions or comments, please list it below. I'd love to read it, and I'll see you next time. Bye.